I'm delighted to have been able to catch up with Dr. Helen Jones. Helen Jones, extraordinaire of Tower Hamlets. Helen, thanks ever so much for making time to actually chat with us. Would you tell us a little bit about yourself and why you're so passionate about young people?
Sure, thank you, Kath. Thanks for your warm welcome. So I am a GP in Tower Hamlets, East London, working in a practice called St Paul's Medical Centre. And I also work for the local CCG as the mental health clinical lead for children and young people and the named GP for safeguarding, etc., etc. Titles don't matter, but essentially I'm really passionate about young people, partly because I have 5 of my own young people in my family. I've done quite a lot of youth work through the years. I've lived in East London for quite a long time. And I've got some really good working close relationships with some of the youth centres in the area. And yeah, I basically think like a child is probably the reason.
And you've developed a really innovative model, haven't you, based on that passion for supporting young people in the best way possible. Would you tell us a bit more about it?
Of course, yeah. So essentially, I went into medicine slightly as a reluctant doctor, if I'm honest. My passions really were about seeing change in communities and social justice, and helping bring holistic care to those that probably find it the most difficult to access. That passion's taken me to other parts of the world as well, but I found my home in East London. And what basically started was a simple ask about 4 years ago from some of the local youth workers who were engaging with some of the, I wouldn't say most vulnerable, but local young people who were facing a lot of adversities. And the youth provision had already done a massive amount to engage with them, brought in a lot of other local and national agencies, but still they had a lot of unmet health needs that were being exacerbated by access barriers to health. So they started with a simple ask to see if a GP could come and start a clinic in their youth provision. This simple ask actually then we further explored by talking to the young people. We conducted a number of studies along with Young Minds and NHS England, and also looked at other national voice that young people were sharing, which echoed what the young people were saying. And really the simple solution was to bring health into a place and space where young people were already engaged, had trusted ongoing relationships with people that looked and spoke like them, so the local youth workers, and were there that they could help support them navigate the offer that we could bring. We drew a lot of inspiration from the Well Centre in Lambeth, started by Steph Lamb and shared with Red Thread and other providers. But the difference for us really was that we were taking care to where the kids already were rather than having to draw them in. So in a very brief nutshell, we started this provision just about a year or so ago, along with some other Public Health Commission services, basically young person-centred care around them where they feel safe to be.
What do you think are the key lessons that you've learned over the last year that service has been running?
The key lessons, lots of them. Personally, for myself, it's something that has consumed me because I've seen the unacceptable barriers that young people are facing on a number of levels, and I could go into detail. I feel that the key lessons are that there is the national mandate out there to do joined up collaboration across the sectors in community spaces, but as yet the structures to facilitate that in terms of from the top to the bottom are still forming, and it's still not an easy, straightforward thing to bring about. I think key lessons mean for me listening always to what the young people are telling us. We ask for young person voice, we might listen, but it's really hard to act on it. But once you've heard it and heard it repeatedly, you can't ignore it. And also that you can't do it on your own. So what's become a passion / obsession, it requires to have other people on board with you that are equally passionate. So I've been invited in by the youth provision. They already saw these problems, but I now through this journey found lots of a bit cheesy, but kindred spirits who certainly want to see the same thing happen. So on a local level, but also broader level up to the top, really.
if we've got colleagues across the country, Helen, who are listening to your story, to the journey that you've been on, are there any hints and tips that you could offer them if they're beginning to actually go through this process?
Yeah, for sure. I mean, I think we went through a number of phases in the journey, and as I said initially, there was a lot of scoping of what's currently out there and collation of young person voice, confirming what we were being told, and then we then took it to local commissioners to explore. I think still, yeah, it's a really tricky one, Kath, because I think we're still trying to influence the structures and the commissioning world in terms of seeing that model replicated elsewhere. So I think for now, what I see as key opportunities are the PCNs, for instance, and that local population emphasis, and the duty that we have as providers to remove barriers to access. That's something that we are mandated to do, and to address the social inequalities. I think it's the challenge of we started something grassroots, and yet still the mechanism to replicate is still not fully formed. So I think it's quite, it stretches my mind a lot, but I keep reading studies that are coming out all the time that endorse this, and also the public health response to youth violence. I know that in hospitals, in A&E departments, they're already having elements of this model with health and youth workers together. So it's about also exploring it with our other partners and joining forces. So as the collective, that voice is really emphasised.
I'm very aware that in terms of your links with the integrated care system, one of the elements was actually commissioning a piece of research to actually evaluate the impact of that. Do you think that approach and the support from AYPH, the Association of Young People's Health, is helpful and something that we could be doing more of, possibly to share the learning from these types of programs as they go forward?
Without a doubt, 100%. And I think that was one of the, again, you asked about key lessons for me at the start of this journey, realising there's little bits of evidence out there about young people's health needs and the issues they face, but we need a lot more evidence. We know it's common sense, the things that people are telling us, but in order to validate it, it does need that independent evaluation. And having AYPH on board was completely invaluable, not only just for our little project, but also in order to explore other challenges that the young people are facing, like the fact that under 18s can't access primary care digitally for themselves in the vast majority of cases. And they knew where to help me take that query to, and how to influence. They're connected on a national level. And for instance, young people that we're seeing are disclosing, historical sexual abuse and really traumatic stories. AYPH were just a really valuable asset in order to help me take the concerns that I was picking up about perhaps areas for improvement within the service. So they certainly steered us in the right direction. So yeah, very grateful to have had them walk with us through these initial phases, and I still will liaise with them about future steps for sure.
And one of the elements that I think we're often challenged about is, how much does it cost? Is a challenge for us? Is it something that we need to address? How have you managed to get around that, Helen?
Yeah, so how much it costs is not a straightforward answer whatsoever. So we have embedded the model here in Tower Hamlets through the extended access hubs, which used to be called the walk-in centres. So that's our governance, that's our funding stream at the minute. But I know that funding stream will soon change and go straight to the PCNs. What we also are mindful of, that the cost is, we are using the youth provision, we are using their space, we are using their workers. The bit that I bring as a GP, in my view, is a very, very small element. Because the vast majority of the work and support for these young people happens outside of my consultation session, and it's an absolute privilege to have the youth workers in the consults, even this week, blown away by what they were able to unlock in young people's presentations and stories, which I would have been scared to ask, I'm not going to lie. So I'm also very mindful that youth services have been cut, their funding has been cut massively. So, I mean, we're still in that phase of trying to calculate in hard figures, the actual cost, but what I would say is the costs that it may incur will be recouped many times over, because what we're doing is we're reducing the gaps between services working together that young people fall through. We're reducing the DNAs, already we've seen this, so that the youth worker can support the young person to access CAMHS or the sexual health service, because they nudge them, they prompt them, they go with them. And equally, we have already seen avoidable admissions being avoided and crisis presentations being de-escalated, or post-discharge a really good wraparound support, which means that young person doesn't bounce back. So for sure, and it's that synergistic working, isn't it? You know, I am using and abusing the youth workers. They are doing so much more, but they think I'm wonderful. I mean, little do they know, I'm just there as my little GP in my little role. But they're like, well, I guess what I bring as the primary care clinician, it doesn't have to be a GP, don't get me wrong, is that we can then help plug into the wider health system, which is hard to navigate, no one can deny. So I will upskill the youth workers with health knowledge, and they will upskill me with how to support young people in a better way.
Helen, thank you so much for sharing your journey and for inspiring us. I'm hoping that in the years ahead, we're going to have youth centre provision naturally as part of primary care right across the country. So thank you for leading the way.
Oh, absolute pleasure. Thank you for your encouragement continually.